Focus. Snap into character. So, if you're dealing with a sick patient, a bit of nausea and vomiting, what are two things you can do? You know, you can give some medications. This will take time. If they're vomiting, no good to put medication in the mouth. It's going to take time to either get a vein, get intravenous access. Even if you have access, you got to draw up the stuff. The patient's there, quick, get a bag. Oh. You're going to get a bag, but here are two other things you can do. You go to and you always have this in the pocket anyway, don't you? An alcohol wipe. And in an alcohol wipe is isopropyl. And this is a strong alcohol, and smelling that does significantly reduce nausea. You got to rip this off and you got to give it to the patient. Here, smell this. And this stops nausea in a lot of patients. But you got to sell it, you know, because they are in the throes of an illness. They're trying to get their guts on the floor, and you just stick this in the nose, you know. So you got to sell it and sort of explain. There's evidence behind this, randomized controlled trials. I'm not sure you need to say that. I mean, the poor patient's sick. They don't want to hear about literature. But I always sort of say, listen, you know, whilst we get you some other stuff, this helps quite a few patients. Have a smell of that and see if it works for you, you know. Then they're on board. And then you got to throw in a joke, because that always sells a bit of nausea. So I always say, like, to the patient, do not tell the pharmaceutical company that we've come up with this as a solution, because then they will put it in a pill and start charging for it. The other trick you can do is here, 3 finger breaths below the wrist crease. So you know, just wrist crease is there. 3 finger breaths below, in the middle. This point is called P6. This is a bit of old Chinese medicine or acupressure or whatever, but this has also been studied, and particularly in hyperemesis gravidarum, you know, pregnant people who vomit a lot. If you put a bit of pressure there, this stops the nausea and vomiting as well. And that's why those seasick bands exist. Put a bit of pressure there, both sides. Couldn't get any better than that, could it, huh? So next time you're encountering a sick patient, medication's on the way, but in the meantime,